Alvarez, the authority on health issues.
You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking to cosmetic dentist, Dr. Sevely. Dr. Sevely, we're talking about veneers. Take me through the process, what they go through on day one.
Well, day one typically is, in our office, we take a lot of records. The records consist of usually x-rays, molds of their mouth, and a great deal of photography. And then we sit down for about 20 minutes and talk with our patients.
Okay, what are you talking about?
Well, we have to sit down and find out, well, what do they want the end result to look like? Because as you know, every smile, every mouth is so different, and everyone has different ideas on what really is attractive. And actually, what I'd like to do, if we could maybe show some of the photos.
We've got a lot of photos here. Okay.
Well, this first patient came to our office, and for years and years, he had complained to himself about how his teeth just looked funny. He noticed that the edges of his teeth were being worn. And then he told me one day a kid, he was a tall man, a child was playing with him at a family function and called them shark's teeth.
Is that right? Okay.
And with him, he wanted to know, well, what were his options available? Now, interesting, he was a very unique case where he's in a very public figure, does a lot of talking, speaks for a living.
Okay.
And so he wasn't in a position where literally he could even be numb at all for an afternoon.
Okay.
So we decided to use probably one of the more newer materials on the market, which doesn't require any drilling of the teeth or any shots, and no temporaries to be made. So when you look at the next shot, he didn't want really a Hollywood smile. He just wanted something that would soften the edges, something that wouldn't require a lot of downtime or much time in our dental office. He probably was in my dental chair for maybe a total treatment time of maybe an hour. Randy, look at the before and look at the after.
Okay.
And in this case, I think we achieved a really very natural...
It's a younger look.
It is. It's a younger look. It softened him. And what was great about in this case is that it really didn't require any drilling at all.
So what did you do?
Well, we used a material that it's literally as thin as a contact lens. And in his case, all we were trying to do is simply cover the teeth or soften the look by rounding the edges of the teeth and lengthening them a little bit.
So are these veneers? What are they?
They're veneers. So what we did for him is we did 8 veneers. And I can tell you, he's just so happy that we did the work.
Now, what is the downtime on him?
In this instance, there was really no downtime. He came in for a total of 2 visits. He was in the chair for maybe a total of about 30 or 40 minutes for each appointment. And by the second visit, he walked out of the office and went right back to work.
Now, going in, did this person think they needed braces? Is this what you call instant orthodontics?
Absolutely.
Okay.
And he had asked me about what his options were, and we did talk a little bit about braces. Again, being in a public figure, the idea of having to wear rubber bands or having any type of appliance in his mouth, he just wouldn't be in a position where he could afford to have his speech affected or appearance being affected. Randy, take a look at this next patient.
Okay. Oh boy.
Well, just so you get a sense that we're not all about cosmetic dentistry, we do have needs, and in this case, this gentleman lost his front tooth, and he came to me and he said, I just want to fix the one tooth. I don't want you to have to drill on the adjacent teeth. I'm not looking to have my mouth redone. I just want to replace the one tooth that was lost.
Okay.
And
so what were his options?
Really, his options were really to either do a denture, which is something that comes in and out of the mouth, and for a young man like himself, really to be wearing something that's going to be, he'll be taking out each night and putting on his nightstand every night that he slept for the next 60 or 70 years.
Like a bridge or partial? What's it called?
It's called a partial denture.
Okay.
And while I'd say 20 years ago that would be considered adequate treatment, more and more patients just are shying away from it, just from the standpoint that it's so big and isn't really that comfortable.
Okay.
Another option for him would be to do a dental bridge. In his case, we had 2 perfectly healthy teeth adjacent to where he was missing a tooth. So since he just unfortunately lost a tooth due to some bad dentistry, the last thing he wanted to do was to touch 2 other teeth.
Okay.
And understandably, in his case, we decided to do a dental implant. if you take a look at the aftershot, I think we achieved a really great result. What's the incredible thing about the implants now is that in the past, where we were simply tied to using titanium or these rather large masses of metal, when you place them in the cosmetic zone or in the front part of someone's mouth, it's hard to hide that.
Okay.
And in his case, we opted to use a newer type of implant, which basically looks like a tooth and has all the same properties to where when you smile or when you talk, it's going to feel and look like
And it doesn't come out.
tooth.
So that's how long will that last?
It should last until he...
So as long as, I mean, just
for
like
all
his other
practical
teeth.
purposes, it should last as long as his own teeth. Sure, absolutely. All right, well, here's another patient we did where a gentleman in his 60s had a lot of wear on his bottom teeth and was at a point where he just woke up one morning and said, gosh, my teeth are so short and
Now
worn.
his upper teeth look fine.
Well, his upper teeth we did a number of years ago.
Oh, I see, okay.
And at that time, he wasn't as concerned with the bottom teeth. But as you know, as we get older, everything tends to sag. So more often than not, on our more mature patients,